TRT World's health correspondent Nicola Hill joins us now from London. Nicola, why is this happening? Why are we seeing an increase in eating disorders now?
It's because of the isolation. People haven't been able to access the community services, the support services, even just interacting with their friends. If you think of how many people have been in lockdown the whole time, and this is something that is definitely concerning. I mean, the figures that you gave there, I was speaking to the people who run the Ori clinic here in London this morning, and they've seen a 90% increase in people ringing up for help. And I said to them, is this the people themselves? Is this parents? And they said it's a mixture. It can be worried parents, it can be partners, it can be family members. You know, we think of it as predominantly a female problem, but it's not, it's men as well. And as you just said then, Maria, it's not just teenagers, it's adults as well. In fact, in the UK, just in the last month, we had 2 very high-profile women who died from eating disorders. And that's something that, you know, you have to remember. This is a mental health illness that can be fatal. It's actually the most fatal adult psychiatric disease, which is really worrying. So yes, it is this situation. Kerry Jones, who's from the Ori clinic here in London, has said it's the fact that people haven't had that interaction. They haven't been able to see their friends. They've been stuck in their own homes. And that has had an impact on their mental health, because it's the anxiety that can actually really aggravate it. And I was also talking to the mum of a teenage girl who has bulimia. And she said one of the issues with young girls in particular is, before we had this pandemic, before we had the lockdown, these girls were normally an average size 10 in the UK. They exercised, they ate healthily, they were outside doing after school clubs or something like that. They've been stuck in lockdown, they've been binge eating. They suddenly realise they're going to go back to school, back to college. They've jumped from that UK size 10 to perhaps a size 16. So they start bulimia, they start starvation diets, and that's one of the beginnings of an eating disorder. And that, unfortunately, because they've had no control, and that's one of the things that Kerry Jones has said, is that they've had no control of other aspects of their life. So the one thing they can control is the food.
It's very sad indeed. And Nicola, what advice are physicians giving to parents?
To talk. And that's one of the most important things, is to open up those levels of communication and to notice, to look out and see whether, you know, your teenager or your partner or whatever is avoiding certain foodstuffs. But the way you do it is something that they say that's really important. It's just to say, look, I noticed that you're not eating this, or I noticed that, shall we talk about it? Because they do say that an eating disorder is not necessarily somebody just wanting to lose weight. It's not necessarily body dysmorphism. That can be one of the elements. It is a mental health issue. It often is linked with anxiety. So the Ori Clinic has a whole list of top tips of things to do. And one of them, you know, the most important one is to talk. The other thing they say is to make sure that you do find a specialist who can help. But that's difficult, because there has been some research here in the UK saying there's been a 128% increase in waiting times for young people to see a specialist. And that in itself is bad, because if you're not getting the help you need, the disorder can become worse and worse. So the other thing they're saying, I'm listing these tips they've got here, is to make sure that you educate and inform yourself as the parent, as the family member, so that you do understand that this eating disorder is a form of mental ill health. And also to take care of yourself so that you can look after them, because of course the concern and the worry that you're going to have about your child not eating can be manifested, can be picked up. Many of us, as you know, who are mothers, know that not to complain about your elements of your body in front of your children in case they copy you. But they do say that isn't necessarily the main issue. The main issue is anxiety. It's a control issue. It is a form of mental illness, and it needs treating properly.
Very concerning indeed. Nicola Hill, thank you so much for that.